Hello and welcome. Very good afternoon. You're watching The Big Story. I'm Afrida Rahman Ali. We begin with getting you all the details coming in on the Prime Minister's speech delivered just a short while ago on India's rollout plan for the COVID-19 vaccine. After chairing the all-party meeting on COVID, PM made a big announcement regarding the progress of the COVID vaccine, saying that the scientists are confident that within the next few weeks an announcement will be made. He added that the costs of these vaccines would be determined post-consultation with states. Praising India's progress, Prime Minister added that India has managed to do what even the most developed countries in the West failed to manage. Let's listen in to what the PM said.
माना जा रहा है कि अगले कुछ हफ्तों में कोरोना की वैक्सीन तैयार हो जाएगी। जैसे ही वैज्ञानिकों की हरी झंडी मिलेगी, भारत में टीकाकरण अभियान शुरू कर दिया जाएगा। इसमें प्राथमिकता कोरोना के मरीजों के इलाज में जुटे हेल्थ केयर वर्कर्स, फ्रंटलाइन वर्कर्स और जो पहले से गंभीर बीमारियों से जूझ रहे हैं, वैसे बुजुर्ग लोगों को दी जाएगी।
News that we are breaking to you now. Strong reactions coming in after that speech, after PM Modi said that the centre is in talks with states over the pricing of COVID vaccine. Congress hit out, alleging that crores of rupees are being spent on personal vanity projects by the Prime Minister instead of the COVID vaccine. Congress also questioned the BJP over its free vaccine promise made during the Bihar elections.
आम जनता है हिंदुस्तान की 130 करोड़ आबादी, इनके लिए कोई रोड मैप आज की जो प्रेजेंटेशन उनमें नहीं मिला हमें। ये बात मुझे समझ में नहीं आया। हु नीड्स टू बी वैक्सीनेटेड विल बी वैक्सीनेटेड, लेकिन ये कौन तय करेगा कि किसको ये जरूरत है या नहीं? तो इनको सब्सिडी में दिया जाएगा या मुफ्त में दिया जाएगा, इसका कोई दिशा निर्देश आज की जो ऑल पार्टी मीटिंग इसमें नहीं दिया गया।
Well, so those are the questions already raised. The Prime Minister in his address tried to answer some of the concerns on who gets it first, when will it be available, and also how will the distribution network work. So joining me this afternoon, Dr. Shekhar Mande, who is the DG of CSIR, the Council for Scientific and Industrial Research. Also Dr. Subhash Salunke, who is a Senior Advisor of the Public Health Foundation of India. I welcome you both to Mirror Now. We are going to have an important discussion on the points made by the Prime Minister, who also happens to be the President of CSIR. I'm going to first listen in to my colleague Tanima, who will take us through the various stages of development that the vaccines are in insofar as India is concerned. Tanima?
That's right. In fact, in the briefing that the Prime Minister had post that all-party meeting today, he clearly pointed out that there are several vaccines, around 8 vaccines or so, which are in different stages of development in the country, and we are bringing to our viewers the status of some of these key vaccines which are going through different stages of clinical or human trial. If you look at the first few ones, it's the AstraZeneca Oxford vaccine, which is of course popularly known as the Oxford vaccine, and it's developed in partnership with the Serum Institute in India, and currently it's in stage 3 of clinical trial. Remember, the Prime Minister had also visited this center last weekend in order to take a stock of the situation personally. And what we do know is that globally, there's supposed to be 70% efficacy of this particular vaccine. If we look at the following one, there's also the ZyCoV-D vaccine, which is developed by Zydus Cadila. And this is being done in a center at Ahmedabad, and also currently it is completed phase 2 of clinical trial, which means it has also applied for phase 3 clinical trials, which are likely to start shortly. And the last one that we are bringing for our viewers, Covaxin, developed by Bharat Biotech in collaboration with ICMR, that's happening in Hyderabad, and at the moment it is in phase 3 of clinical trial. So all these vaccines are in final stages of trial, most of them at least. Remember also the Russian Sputnik V vaccine, that is also something which is for which trials have started. So what the Prime Minister essentially was telling us is that after having visited those COVID centers himself, spoken to scientists who are actually a part of those trials, who are in fact leading those trials, they have in fact assured him that it's most likely that in the next few weeks, India is going to be in a position to have that COVID vaccine. The challenge, of course, remains on a rollout plan with the states and exactly who will be the target group which will be administered the dosage initially.
Yes, and that's exactly what we will discuss right now with Dr. Shekhar Mandey and Dr. Subhash Salunke. Dr. Mandey, you're the Director General of CSIR, and we heard the Prime Minister talk about that there is a huge reliance on the scientific community now to show us the way ahead and literally waiting for those approvals to come through. So the big question in everyone's mind about the rollout plan now, 8 vaccines in the race, 3 indigenously developed. How far are we really from hearing an announcement? What are the important approvals, regulatory approvals, so to speak, perhaps, that are still pending?
So, as you correctly saw just now, there are a couple of candidates in phase 3 clinical trials. And once the phase 3 clinical trial results are done and they're analyzed, that analysis along with the raw data is put forth for consideration to the Drug Controller General India, or CDSCO, and there is a subject expert committee which looks at the data, and if the data looks convincing, then they give an approval for vaccine to be taken. Now, what we expect is that there would be an emergency approval that would be given. That's probably the expectation of most of the people based on the data that is being generated, because the kind of trials, large trials, we cannot probably wait for all the results to come in, but an emergency approval can be considered. And that's what I believe is the expectations of the people are.
Yes, absolutely. And the next question, of course, then arises on the exact level of preparedness when it comes to the distribution network. Dr. Subhash Salunke, how ready are we for an immunization program of this scale and magnitude for a country as big as ours and a population as huge as ours? How ready are we with the necessary public health infrastructure for a rollout of a COVID vaccine? Well, Dr. Subhash Salunke, can you hear me? I wanted your comment on the rollout plan in terms of the level of preparedness that India is at, whether we are indeed infrastructure ready to roll out a COVID vaccination program. Okay, I'm afraid Dr. Salunke is not able to hear us. Dr. Mandey, you of course are in a very authoritative and important position right now. The CSIR, as I understand, has been extremely active in India's fight against COVID, whether it is in developing the antiviral drugs or, for that matter, developing new testing methods, and now again studying the coronavirus genomes. So at this point in time, the cost factor, it's not only about when are we getting it, how will it distribute it. The important point also is about at what cost are we going to get it. The information that we have, and this is as per a Times of India report, that there's already been a bulk order of at least 3 vaccines of 1.6 billion doses. Can you confirm that for us and also tell us that can there be a multiple approach? Will there be not one but multiple options for vaccines in India? Okay, I am not able to hear Dr. Mandey. I think there's some issue with the connection there. Extremely sorry for that, viewers. But these are important developments that we are tracking today. We are trying to understand the situation in terms of the roadmap for India. Now we are already in that position where we have to see how ready are we. Will the states cooperate enough in terms of having the correct infrastructure to roll out an immunization program, how many people will get vaccinated and who will be the first to qualify for a COVID vaccine. Those are important questions, as also is the question of the supply network, that we have currently in India, whether it is sufficient. We already do have had several of these mass immunization programs, and therefore the Prime Minister himself said that there is an existing network which we can rely on. But is it sufficient? Do we need to add, or do we need to make it more robust? Those are questions which we will have to answer. Let's bring in some breaking news coming in. Health Ministry has communicated that vaccine in India will be way cheaper than what is available in foreign countries. Government to bear the cost for the priority groups only. First in line will be almost 1 crore healthcare workers across the nation. So this is concrete information now coming in. Ayushman getting us the details. So Ayushman, just when we had the Congress party and Adhir Ranjan Chaudhary questioning that what would be the cost of the vaccine, what happened to the promise of free vaccine, we have some clarity coming in?
The government has said that the priority groups will be the one where the government would be giving the vaccine for free. As of now, it has also been said that it is anticipated that when the vaccine is rolled out in India, that would be way more cheaper than that is available in all across the foreign countries. But also pointing out the fact that if you go through the priority groups, at least the healthcare workers are the ones who have been currently identified. The number comes at around 1 crore, and the government is keeping priority wise to vaccinate them once the vaccine is rolled out. So these are all the basic discussion that was taking place when the meeting was taking place of the health ministry officials and the all-party meet.
All right, thanks for joining us, Ayushman. Dr. Shekhar Mande is back with us. Dr. Mande, I was asking you that, at this point, the big questions are around the infrastructure and the cost of the vaccine. How ready are we in terms of the supply chain? I also want to know from you whether there can be a pronged approach. Can there be multiple vaccines rolled out in India?
It's obvious that there will be multiple vaccines if they get regulatory approval. So once the regulatory approval is cleared, there are multiple candidates, and in that situation, of course, there will be a choice of different vaccines that is available. In terms of infrastructure, I think we are blessed with very good infrastructure as far as the supply chain and all logistics are concerned. And that's because we have a very successful universal program. In fact, we've been among the best countries who have implemented universal immunization program. So the track record is pretty good on that particular front. So different vaccines have different challenges to be distributed. For example, if Pfizer tomorrow decides to come in India, their vaccine is transported and stored at -70. If Moderna decides to come to India, once they get approval, then their the storage requirement is something like -20. While the Oxford AstraZeneca vaccine, the storage requirements are 2 to 8 degrees Celsius. So that is probably easier to handle than the Pfizer or the Moderna one. But nonetheless, there will be multiple options which will be available. And for different options, there are different advantages for having them either or being administered to people.
Right. Dr. Subhash Salunke, do you agree with the fact that we already have an existing network, and like Dr. Mande said that, we have a good track record in dispensing with this kind of an immunization program? Do you see any challenges for us, especially with an adult vaccination program, firstly, and how much more really needs to be done? How much work is left to kind of make this supply chain network absolutely ready to distribute and to vaccinate the population?
This is the first time we will be embarking upon adult vaccination on such a large scale. So to say that our infrastructure and logistics facilities are up to the mark is too much an optimism. As a matter of fact, there are some people who equate this with the election mechanism or census mechanism. That's far from a ground reality. As a matter of fact, logistics, developing vaccine is comparatively now becomes a easier task. It is already accomplished. Number two, there is a tremendous amount of political commitment. Number three, the infrastructure that exists today in the country certainly has strength, particularly seen during the pediatric or immunization program, universal immunization program, or Mission Indradhanush. But to say that same will get translated so easily for adult vaccination is something I think we need to test it. So as far as I'm concerned, we have states in the country where the human resources available at the peripheral level is a question even now. And the national programs which are being implemented at this stage are facing a serious challenge. Now, what we are going to undertake is something totally different. So I personally feel that every state will have to really be sure that what we are embarking upon, what we are planning to do. So I'm not going to be easily accepting that we have everything absolutely foolproof. Certainly not.
Okay, so this is going to be a mammoth exercise, no denying the fact that this will take coordinated effort of the center and the states. I want to ask you, Dr. Mande, that the other concern again, because people keep asking this question about how much will it cost and will it become an exclusive preserve of those who can afford it, the affluent lot. For instance, as per the Times of India report today, we've ordered Oxford, Novavax and Gamaleya vaccine, 1.6 billion doses of these vaccines, but they will come for a price. Will the government be able to subsidize these vaccines, or will only a select few people will be able to afford them?
So the question of pricing is best left to the companies which are manufacturing that and the government. And I'm pretty sure that both of them are engaged in discussions with each other with a larger public interest involved in this issue. What Pfizer and other companies have done, some of the companies overseas, they have announced their prices in the respective countries. But those prices need not necessarily hold all over the world. And therefore, we should leave it to the government and the companies to decide the pricing of all of this, considering the public interest, as I said. Back to you.
Yes, which is why there is no clarity, Dr. Mande. But I also want to ask you in terms of coverage of the vaccine. Again, experts tell us that it's not as if you get vaccinated and you are done for life. It is only going to give you a limited period coverage. So in that sense, what happens? Are we going to require a steady supply of vaccines? Will it be a perpetual process? And will the COVID protocols then stay over for a longer period of time?
So these are very open questions at this moment because we are only in the about 10th month of the pandemic and we don't yet understand everything, how much protection we get, how long we get protected, and so on and so forth. They're the questions that everybody around the world are asking, and only time will tell whether we get a very long-term protection by vaccination dose, or we may have to take annual dosage or something like that in just like what we do in flu, something similar. So these are kind of open questions. They will have to wait for time to answer those.
Yes, in terms of preparing a roadmap, Dr. Salunke, how is the government going to go about this? This is a large, diverse, complex country. We heard the Prime Minister say that the healthcare workers, the frontline workers, and those who are at the risk of death will be prioritized. They will be immunized in the first phase. But typically, as somebody who has experience in public health, how does it work? How is a blueprint prepared for an adult vaccination program? Who gets the priority?
I think, as I stated earlier, this is going to be a first of its kind exercise undertaken by the central government as well as state governments. Naturally, the priorities are already decided. That it is the healthcare providers, which include doctors, nurses, and the frontline workers, and those who have comorbidity and higher age group, so that the mortality will be reduced. Now, this is easier said and done. What is right now being done by the government of India and in consultation with the states, the lists are being prepared for the healthcare providers who are at what level, both in the public sector and in private sector. So that listing or enumeration is the first step. After that is done, We will have another list of the people who are likely to be comorbid and high risk. So that's the list. So putting both these lists together, then the next step will be the centers where this vaccine will be carried. Please remember, it will be a combination of the factors that some people will be brought to the centers, and at some places the vaccine will be taken to the centers from where the further delivery will be taken to the peripheral level. So it's a combination of the strategies that need to be carried out. So it is going to be a really gigantic task, and it is also a very important side issue which has a direct implication that the entire machinery of the public health system, private system will be engaged.
Yes.
We have to also take into consideration other issues. We have many other public health challenges. And to put this entire machinery into only COVID vaccination will be a very, 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 you can say, I don't want to use the word, I'm trying to be more cautious. I'm trying to put the word that to ensure that the other national health programs,
I understand,
other non-COVID activities need to be equally taken care of will be another challenge. So it's not only enlisting, it will be involving in training.
Right.
You will have to appreciate that these vaccines are not without side effects. They're bound to have some side effects. So everyone who's going to inject need to know what these side effects could be. It could be very minor. It could be, it could be major. So where to refer them? How to refer them? How to treat them? Please try to understand that we are talking about vaccinating, even if first instance, something like 5 to 7 crore people. Do you think this is going to be so easy? So training and ensuring that people don't get into complications because of improper handling will be another challenge. So there are a lot of challenges.
Yes, absolutely. There are many challenges ahead, and you're part of the task force. So, Dr. Salunke, you are also actively involved in probably deciding on those policy matters, as is Dr. Shekhar Mande, who's been in the forefront in some of the very important programs in India's fight against COVID. I appreciate the two of you joining us this afternoon and giving us so much clarity on the critical issues that is being discussed in the country today on the vaccination program, on the rollout and the roadmap, literally, that the government is perhaps working on at the moment to make sure that this is a effective distribution of the COVID-19 vaccine whenever it is announced, which should not be too far away, is what the Prime Minister told us today. Thank you so much, gentlemen, for joining us and giving us your time.